My name is Kashlan. This is my lovely father, Dr. Muhammad Kashlan, and he will be talking about reopening the Masjid for Ramadan and COVID guidelines during that time and general introduction about COVID and everything. And I'd like to wish everyone in the community a Ramadan Mubarak.
Thank you, Reem. All right. Bismillah ar-Rahman ar-Rahim. Is the slide showing? Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Sayyidina Muhammadin wa ala alihi wa sahbihi ajma'een. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. Yeah. Indeed, it's been a very difficult year for all of us, dealing with this pandemic that nobody is prepared for it. SubhanAllah, even as a physician, when we go to medical school, we never learn about how to deal with these issues and how to deal with patients who are dying in a mass numbers. It's very emotional and very difficult for all of us. I will start with the ayah from the Surah Al-Baqarah, Chapter 2. Allah subhanahu wa ta'ala is testing us. He said, Bismillah ar-Rahman ar-Rahim, وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِّنَ الْخَوْفِ وَالْجُوعِ وَنَقْصٍ مِّنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ وَبَشِّرِ الصَّابِرِينَ. And most certainly shall we try you by means of danger and hunger and loss of worldly goods, of lives and of fruits, but giving glad tidings unto those who are patient in adversity. So we have to be patient. الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون. Who, when calamity befall them, say, verily unto God do we belong, and verily unto Him we shall return. We should live this. Allah making us live إنا لله وإنا إليه راجعون. أولئك عليهم صلوات من ربهم ورحمة وأولئك هم المهتدون. It is they upon whom their sustainers' blessing and grace are bestowed, and it is they who are in the right path, on the right path. Sadaqallahu al-Azim. So we are tested. Let's review the current statistics of this pandemic. The globally confirmed cases exceed 134 million cases. The global death exceed almost 3 million. The United States confirmed cases, 31 million. The US deaths is 560,000 people, more than that. In Michigan, we have, unfortunately, 804,000 cases, 17,450 deaths, and the vaccination is going well, and looks like we are at 19% right now. I would like to share with you this link. It's a short video. You can increase the volume, there is. It's not up? Is it showing on YouTube, I hope?
It's not.
Oh.
Are you on Zoom?
No. Okay. I guess I cannot share that with you. It's just the statistics in motion for the past week. It's from Johns Hopkins website. You can look at it. So what is COVID-19? COVID-19 stands for Coronavirus Disease 2019. It's caused by a virus called SARS-CoV-2, Systemic Severe Acute Respiratory Syndrome Coronavirus number 2, because there's coronavirus number 1 caused severe respiratory illness in the past. This virus appeared, as you know, in 2019 and quickly spread around the world. People with COVID-19 can have fever, cough, difficulty breathing, and other symptoms we're going to go over, inshallah. And the most organ affected by this virus is the lung. So I want to share with you what's acute upper respiratory infection. So usually the virus enters from the nose or the mouth, and then it latch into a receptor on the epithelial cells, which is the surface cells of our respiratory system. It might be contained only in the upper respiratory, so you'll have only upper respiratory symptoms, including sore throat, runny nose, or headache. But sometimes it progresses into the trachea, which is the windpipe in the lung. And that's called bronchitis. If it goes further, then it's called pneumonia. And that's when it affects the actual lung tissue that we breathe through. As you know, the function of the lung is respiration, meaning taking oxygen from the air and getting rid of carbon dioxide, which is produced by our body metabolism. So that exchange happened in the actual lung tissue. And when the lung tissue gets affected by the virus has direct access to the blood and can cause viremia, which means infection of the blood with the virus. And that's the danger become reality. And that's how people end up having low oxygen level and end up having severe lung disease. So that coronavirus happened, as you know, in China, in Wuhan city. And unfortunately, they did not follow our prophetic education to stay in. If a calamity happened, if a plague happened in a city, Prophet Muhammad said, nobody enter the city, nobody leaves the city, you contain it. And if they done that, would have not had that pandemic, unfortunately. Did not happen. So let's go deeper into the virology. Corona in Latin means crown. And as you look at the picture of the virus, it looks like it has a crown, those spikes that we call them protein spikes. And that's basically the key, the access of that virus into our cells. That's where it's latched, by those spike protein. And corona has been known for a long time. Actually, most of the common cold that we get is caused by coronavirus, but it's alpha, from the family of alpha coronavirus. Most of the severe ones are from the beta coronary virus. And to go in history, in 2002, that's the first coronavirus happened, COVID-1, or called SARS. And it also originated in China. And the original reservoir was the bat also. But only 8,000 cases happened and only 755 deaths encountered from this, because the incubation period of that virus was short. Incubation period means the time from the virus enter the body to the time of developing symptoms or showing symptoms. So since that incubation period is small, that little epidemic was controlled. And then in 2012, we have the Middle Eastern respiratory syndrome, which also caused by coronavirus, originated in China also with bat. And the camel was an intermediary host. And also, because of the incubation period was short, that disease was contained. Unfortunately, with SARS coronavirus 2, the incubation period is very long. It's 2 weeks. So people will have no symptoms for 2 weeks, and they're spreading the virus everywhere. And that's the setup for pandemic, basically. And there's a family of gamma and delta of coronavirus, which affect birds, does not affect humans yet. So you wonder why bat is the origin of all these viruses. It's the only flying mammal, subhanAllah. So Let's go deeper. Let's go deep into that virus. So if we look at under the microscope, you see those are the spikes, those are protein, those are the key that enter the cell. You see that the brain of the virus, which is the RNA, okay, this is the brain of the cell of the virus. And that brain of the virus with the RNA has a cap, has a body, has a tail, and it also has an envelope. And this RNA virus is one of the largest RNAs. It's large, and the larger RNA, the more chance of developing mutation or changing itself. The larger RNA, the more mutation you get. So the cap, the first of the cap is to resist degeneration by the cell. So when they enter the cell, the cap will prevent that virus from degeneration. The body encode the non-structural protein of the virus, and the tail encode the structural protein, which is the spikes and the membrane and the envelope. So the tail is a big problem for us. So it encodes the spike, would attach the host ACE2 receptors on the cells. That stands for angiotensin converting enzyme 2, which present actually in our respiratory system, in our heart, in our GI system, our kidney and brain. So that's what the virus affects, all those organs that has the ACE2 receptor. And also the tail also encode the matrix, the envelope, and the nucleocapsid. So here's the virus trying to enter our cells, in the nose, let's say. This is the virus, here's the spike, it attaching to the lock, key unlock, and opens the door for the virus to enter into the cell, and then use the actual cell factory to produce more viruses. So the virus cannot replicate by itself. It needs to use our cells to be able to replicate. And that's a new virus coming out, and that's the problem that we're facing. So as we mentioned, the longer and the RNA virus, the more chance of having different variant that cause COVID-19. And as of now, we have 3 bad variants we're going to talk about. So first, the virus makes mutations, and when you have multiple mutations, that cause variant. So we have the UK variant, which now almost 40% in Michigan. We didn't have any of that. We have the wild one first, the common one, and now the UK variant. And then we have some South African also virus, the variant. And now I hear there's one case in Bay City for the Brazilian P1 variant. And that's a little bit alarming because that variant has 2 things in it. Has a mutation that allows the virus to enter the cell faster, okay? And it has a mutation also to evade the antibodies. So even if you got infected with the COVID before, this variant might hit you. And that's what's happening in Brazil right now. Or vaccination maybe, we don't know yet. So how does COVID-19 spread? When we talk, when we sing, when we speak, we produce those micro droplets, okay? And that's why we wear a mask all the time, right? To prevent this droplet. And that droplet carries all the viruses in it. So person to person, the droplet usually, the size of it more than 5 micromillimeters. It's tiny particles from the infected person's lungs or airway, windpipe, travel through the air to other people who are nearby. So you see the large droplet, it's 1 to 3 feet, Smaller travel further. Now, if we're gonna call airborne transmission, that means the droplet size is less than 5 micrometer. And usually that's happen indoor and where the same air keeps circulating and the virus can spread to other people who are further away. Now, there is evidence that it's probably airborne, but mostly droplet. Droplet transmission of the COVID-19 virus, but less likely to be airborne. So that's why when you hear the COVID enter the house, you see most of the people get affected, because people living together, gathering. Restaurant is the worst place, because people are talking close together, shaking hands, hugging, sharing food, and they don't have masks and they're in close proximity. It's possible to get infected also if you touch a surface that has a droplet in it. So if somebody sneezes on a surface and then you put your hand on it and then you rub your nose or eyes, you can get the virus. So it's possible. It's also possible for the virus to spread from person to animals, okay, like a pet. But there is no evidence the other way around. So there is no evidence that the person could get the virus from a pet. A person can be infected and spread the virus to others even without having any symptoms, right? As we said, because the incubation period is long. Therefore, keeping people apart is one of the best ways to slow the spread. Just buys time, doesn't treat the illness. So what are the symptoms of COVID-19? Fever, cough, sore throat, shortness of breath, runny nose, fatigue, diarrhea. As I told you, also the GI system has those receptors that the virus latch into, vomiting and nausea, loss of smell and loss of taste. And we think it's probably loss of taste and smell from the brain receptors. And I see those patients, even their oxygen level is very low. They don't feel short of breath. And it makes you wonder if that virus affecting the sensation of shortness of breath. And all of a sudden they get cardiac arrest because their oxygen level is very low. So not having shortness of breath is not an evidence that you don't have severe disease. You need to check your pulse oximeter. It's a good investment, $13. You can buy it from Walmart. So as we mentioned, fever, cough, difficulty breathing, feeling tired, shaking, chills. Chills means viremia, means the virus reached the blood. When you start having chills, that's not a good sign. And some people report some rashes. Any viral illness can cause rashes, but that virus also affects the coagulation system in our body. It makes our blood thicker, makes our form clots more often. And this is a COVID rash. And that's also COVID toe. And that's probably from clotting. The end artery of the toe is getting blocked by clot. And that's what you see there is the tissue start getting necrotic. Am I at risk of getting seriously ill? It depends on your age and health, right? I should share with you only mortality is 2% of this virus, but because there is a lot of people get infected, that 2% become a big number and overwhelm our system, health system. So who are at higher risk of getting seriously ill? Anybody above age 65, their immunity system is probably lower, so they're more likely to have severe illness than people who are younger. People who have serious heart disease, chronic kidney disease, type 2 diabetes or type 1, or they have chronic obstructive lung disease, the chronic smoker, that we call it COPD. Increased body mass index, increased weight, but obesity also is a risk factor. We're seeing that right now. We're not seeing any more elderly people actually in the hospital. We're seeing more younger people now. As most of the elderly looks like vaccinated, we're seeing the middle-aged people and young people, and they're coming severe, especially the obese people. People who have HIV or on chemotherapy also, people who are asthmatic, they have cystic fibrosis, hypertension, or sickle cell disease, also at risk of getting seriously ill. So how do we check for the virus? Nasal swab, everybody knows that, right? See how where that cotton swab going into the back, nasopharynx, okay? So we have rapid test, which check for the antigen of the spike of the virus. It's fast, but not as accurate as the nucleic acid test, which is the one that you wait for the next day, because it's looking at the genetic material of the virus. and it gives you false negative sometimes. Depends if the person didn't do it right, didn't go deep enough in the nose, that sometimes can give you false negative, the antigen test, the rapid test. So the nucleic test is more accurate, but sometimes give you false positive also from other coronaviruses. So you have to look at the patient. You have to look at the whole picture. The antibody test people ask about, it just show you if you were exposed or you're infected in the past. It's just like a memory of the infection, if you will. Does not mean that you have infection right now. It means that you were in the past acquired the disease. So we don't use it usually. If somebody, let's say, want to know if he got the virus or not, you can check it before. But it takes like few weeks to develop or to titer to be high. I'm going to show you the difference between normal and COVID. Okay, and I'm going to apologize in advance because I'm going to show you a pathology slide of autopsy of a lung of somebody who died from COVID. So your discretion is advised. If there's little ones, maybe they should not see that. So this is the X-ray of a normal person. What you're looking at is the heart in the middle, the rib cage, you see those ribs? Okay, and everything black is air. Lung is filled with air. Everything black is air. See the COVID lung? This white stuff that you see inside the lung? The lung is preoccupied with this infection, overwhelmed. This gentleman has a tube in his throat. As you see here, that a tube is on a ventilator. That's a CAT scan. The CAT scan, imagine as if you're slicing. You're looking to slice into the person. So that's the spine, if you will. And those are the ribs. This is the middle bone in the chest called the sternum. The heart in the middle. The black lung here, which is filled with air. Right lung, left lung. Look at COVID. So inflammation. Look at this. Overcome. That's what we're dealing with on the severe cases. This is another CAT scan, but it's a coronal cuts. You see the normal black here, and you see all this white stuff. Now, this is how the normal lung looks like in pathology, and this is a COVID lung. This is autopsy from somebody who died from COVID, and this was from Chinese literature. In the beginning of the COVID, they did an autopsy, and that's how you see the lung is basically have a lot of thrombosis, a lot of clotting in it. It's black. It looks like a burned down lung. So how COVID-19 is treated? Okay, so if most of the illness, as we said, the mortality only 2%. So most people, they will have mild illness. As we mentioned, the fever, the cough, and we advise them to rest at home and self-isolate, stay apart from other people, including people at home. And if patient high risk, as we mentioned, they have all those diseases that can have, there is a treatment now we give antibodies to this virus. So those patients who have mild illness or moderate illness, and they have risk factors to develop severe disease, it's indicated to give them infusion of antibodies. And antibodies, basically like laser-guided missiles, attack the virus. Or you can give a plasma donated from somebody who had coronavirus before and recovered. So you can give them that plasma that has rich with antibodies, so it can neutralize the virus. Again, this is only on people who have obesity, who have chronic kidney disease, who have diabetes, who are immune suppressed, or their age above 65, or if they're younger, like age above 55, but they have also heart disease or high blood pressure or COPD or chronic lung disease. Also, they will be able to get the antibodies. There's 2 combos of antibodies being on the market, emergency approved by the FDA, and that's what President Trump got, the bottom one. And that's the convalescent plasma that we mentioned. Now, people with severe illness, when they start having shortness of breath, then they might need to stay in the hospital, okay? Especially if the oxygen level is low. And the main reason to be in the hospital is oxygen. There's no good treatment for COVID right now. We have some treatment, we try, but the reason we keep them in the hospital to provide them with oxygen, because without oxygen, they will not survive. There's multiple modes of oxygen supplementation. We can give oxygen by nasal cannula, as you see here, or we can give it with something called OptiFlow. So this is basically oxygen at high concentration with high flow also. And you can give it with something called vapotherm, which is the same as OptiFlow, but this one also has temperature into it. So you can not only humidify the air and put it under high flow, also increase its temperature to normal temperature, so it will be less burning in the nose. This one causes a lot of dryness, sometimes bleeding in the nose. So usually we start with the nasal cannula. If their oxygen doesn't improve, we step into the OptiFlow. If that doesn't get better, we go the vapotherm. And then we go to the BiPAP or CPAP, if you're familiar with it. This is basically not only oxygen, also pushing air through the patient, so it ventilate the patient. And once this fails, we go into the intubation. That tube goes into the throat, to the lung, and that hooked to a machine to breathe to the patient. And honestly, once you reach that point, once the patient reaches that point, it's almost end game. You know, mortality rate, once we intubate people, they're almost mount to 80% if they survive. And if they survive, they need, you know, a lot of support and rehab and so forth. So prevention, much better than treatment. And then in some cases, if the ventilator, we're ventilating and we cannot ventilate the patient, we send them for ECMO. It's basically dialysis of the lung. Only a few centers in Michigan do that. They take the blood out, oxygenate, bring back. But again, it's a very high-risk procedure, and most people don't survive once they reach that point. What other ammunition we have to treat those patients? We have the only two things that showed improved mortality is the steroid and the blood thinner, okay? So the steroid, if you give it early in the case, it will harm the patient, will not help them. Only if their oxygen level is low, then you can give the steroid, because the steroid decreases the inflammation in the lung. In the early stages, the virus is still alive and replicating. We give remdesivir for that. Remdesivir showed that within 7 days, with low oxygen level, it will stop the virus from replicating. Steroid, once the virus creates inflammation, that steroid can suppress that inflammation. And the blood thinner we can give in a dose that's only to prevent clots, or full dose sometimes if the patient develop any clot. It's a higher dose. And now there's a recent study about medication called tocilizumab or Actemra, and we give single dose of that. That's showed improved mortality also in severe cases. There's a lot of studies about ivermectin. Still, observational study looks promising, but nothing materialized yet. There's a recent study about aspirin, retrospective study. It showed that improvement in decrease the chance of going into the ICU, decrease the severity of the disease. So I start using aspirin on the patient in the hospital also. And the aspirin, basically, it's a blood thinner. It works on a platelet. Okay, platelet are the small cells that when we cut ourselves, those cells rush to that wound to put shoulder to shoulder and put the first bridge to close the wound. And that aspirin makes those platelets slippery, so they don't stick to each other. So it will prevent clotting. There's studies about Pepsid and high dose, also melatonin and vitamin D, but nothing showed improving in mortality, which is the end game. So remdesivir, this is the medicine that decreases the replication of the virus. Each dose is $1,000. Usually we give it for 5 days. And Actemra is one dose, $5,000 almost. So scared you enough right now. Let's work on prevention. Okay, so can we prevent COVID? Can COVID be prevented? The only way we can get this pandemic behind us is by vaccination. Social distancing is only buy-us time. It's not ultimately you're gonna get it. If you don't get vaccinated, you're gonna get it one way or another, unless 85% of the population get vaccinated, and then the 15% can get what we call the herd immunity. So until we get vaccinated, we should be very careful. We should practice social distancing. We should wear a face mask, not under the nose, on top of the nose. We should wash our hands frequently, as our Prophet taught us to do, all because tahur shatr al-iman, half of our iman is cleanness. Avoid touching our face, especially if you touch any surfaces that you suspect something in it. Avoid or limit traveling if you can, unless it's emergency, to Mexico or something like that. Okay. So vaccine. Okay, so thanks God that vaccine that we have right now, it's a revolutionary. Actually, it's changed the way that vaccine is made in the future. I think all the vaccine going to be based on a nucleic acid-based vaccine. The traditional vaccine that we have, the flu vaccine and all the other vaccine, what they do is they take the virus, they make it weaker by putting into it a lot of product, including mercuries and whatever, and then they inject it into the person, and the person will mount immunity. Or they can kill the virus or virus particles and inject that, or they can take the protein of the virus, purify it, and then inject it into the person to develop immunity. But all this takes a long time. To develop such vaccine, you need at least 18 months to 3 years, sometimes 5 years. With this revolutionary vaccination, they use the nucleic acid-based vaccine. We can produce it in a few weeks even. And it uses molecular biology. And it's rapid and tailored to changes in the virus. So if the virus keeps changing itself, they can develop a booster of the vaccine that can offset that virus quickly. And that's called RNA vaccine. Let's go over RNA vaccine a little bit in more detail. This is the normal cell. Look at the cell. You have cell wall and you have the nucleus. That's the brain of the cell. Okay? And this is where the protein is made. And that vaccine works in this area. It does not go into the nucleus, as people say, like maybe affect our DNA. It does not. It just works in that area. So basically what they do, they see how the virus make its protein, not making all itself, just the code to make the protein of the virus. They manufacture that, they put it with an E. coli, which is a bacteria, and start producing more the RNA messenger, we call it. And that's basically within a few weeks you can have that, and they can purify it and clean it. And they did studies on that with 40,000 people, and they found tremendous result in immunity. And the first vaccine was in Pfizer. And I think we should feel proud that the person who discovered that vaccine was a Muslim from Turkey, a German-Turkish physician, microbiologist. So basically, they take the RNA messenger, which is the brain of the virus, that code only the protein of the cell, only the protein of the virus, and it's directly injected into the cells and transcribed into the spike protein, the crown protein that allow the virus to go into the cell. And then the body will recognize that and form antibodies, form cells to recognize that protein. So when the actual virus comes in, those antibodies and those cells are ready to attack and stop the virus and arrest it there. And this is the only vaccine that simulates natural infection. All the others are modified, right? This is simulate natural infection. The problem with that vaccine is very unstable. So they have to put it in an envelope of lipid carriers. Then it will stabilize it and doesn't get destroyed in the way. And it needs very low temperature. So we have the Pfizer vaccine, which the efficacy 95%. We've never seen vaccine with such high efficacy. 2 doses, 3 weeks apart, but they have to keep it as minus 112 Fahrenheit. The Moderna vaccine gives us 94% efficacy, also 2 doses. It needs less temperature because of the structure of the envelope that they made that doesn't need that low temperature, but it's still low, it's minus 13. And then they came up with the Johnson & Johnson vaccine, which instead of the envelope, they have a very genetically modified, harmless virus called adenovirus. They use it for gene therapy, and they developed that into a vaccine. So then that virus does not need to be in a very low temperature. You can put that vaccine in the fridge. So it's more stable, can be refrigerated for 3 months, and it's a single shot. The efficacy is 74%. A little bit less effective, but whatever you can get. What is the vaccine side effects? Most of the side effects are local reaction. You get pain, soreness at the site of the injection. And with the second injection, some 40% of people will get like fever, fatigue, headache, and some chills. And if you get that, that's good. That means you got immunity. That means that virus is not deactivated before they gave it to you. So don't be alarmed. There's no chance of that virus to give you that vaccine to give you the virus. So who should take the vaccine? Who should not take the vaccine? I'm sorry. So what's the contraindication of the vaccine? If you took the first shot and you get severe reaction, allergic reaction, maybe you should think of not taking the second shot. Or if you have anaphylactic reaction, it occurred only 4.5 per million of the vaccine all over the world right now. 4.5 per million developed allergic reaction. Anaphylactic reaction means severe allergic reaction. So all individuals should be monitored for 20 minutes after you take the vaccine. If you have history of allergy to other vaccine, maybe you should wait 30 minutes. So somebody asked, can I get infected from the vaccine? No, it's impossible to get infection from the vaccine because you're getting only the protein. The code is only coding the protein of the virus. The protein is not enough to cause infection. If you get attenuated virus or weakened virus, yes, you might get the infection from the vaccine. But this is only manufacturing the protein. Can I still COVID-19 after being vaccinated? Yes, but the disease likely to be milder and not life-threatening. Now, in Michigan, there was 3 cases I heard that died after the vaccine, and I don't know what the circumstances, but again, a lot of people got vaccinated. So that's a small percentage of a problem. We need to see why did they die. So it could be something else not related to the vaccine, but in general, the vaccine is very safe, and the alternative is not good. So when I'm fully vaccinated and have immunity, when I am fully vaccinated and have immunity, so somebody asked, usually 2 weeks, if you take the Moderna or the Pfizer, after the second shot and 2 weeks after, you're immune. If you take the single shot, 2 weeks after that shot, you're immune. You're considered fully vaccinated and have immunity, as if you were infected and recovered by the virus. Do I need to practice social distancing if I'm fully vaccinated? No, if you are around fully vaccinated people. All right, that's according to CDC guidelines. You can gather indoor without mask or 6 feet apart if you are fully vaccinated. That's encouraging, that's good. But if you are around non-vaccinated people, you should practice the same thing because you still can get the infection, you still can transmit it, but it will not be severe. This is the CDC guideline. This is from the CDC. So they say you can have no social distancing and gather without mask. You can travel also. If I had COVID, am I immune and for how long? Yes, you are immune after 14 days of infection. And likely you develop immunity. And likely the immunity will last 90 days. That's why we recommend after 90 days to receive the vaccine. If somebody recovered from COVID and still need to be vaccinated after 90 days, they're immune for 90 days. So what I can do to cope with the stress and anxiety, okay? So we all went through that, including us. I feel physicians should have post-traumatic stress treatment because you cannot believe how much stress we've been through, worrying about our families, worrying about ourselves, worrying about our coworkers, our communities, and I've seen all of this together, you know. So it's good to take a break from the news, okay? Just turn off the TV and contemplate. Practice the ibadah of contemplation. Regular exercise, if you have time, that will be good. And eat healthy food. Find activity that you enjoy and can do at home. And stay in touch with your friends and family members. Nowadays, we have social media, thanks God, so we can see people around us without being physically with them. It might also help to remember that by doing things like staying home, wearing your mask, and avoiding gatherings, you are helping to protect the community at large. We are in this together, all of us, and we have to come out together with the minimum casualties possible. And keep in mind, most people do not get severely ill from COVID-19, right? We said only 2%. And it helps to be prepared, and it's important to do what you can to lower your risk and help slow the spread of the virus, but try not to panic. So Allah subhanahu wa ta'ala asks us to trust Him, have a trust in Allah. He said, أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ما يفعل الله بعذابكم إن شكرتم وآمنتم وكان الله شاكرا عليما. Why would God cause you to suffer if you are grateful and attain to believe? Thankful, grateful, and attain to believe. Let's be thankful and increase our iman. Seeing that God is always responsive to gratitude and all-knowing. Also another verse, أَمَّنْ يُجِيبُ الْمُضْطَرَّ إِذَا دَعَاهُ وَيَكْشِفُ السُّوءَ وَيَجْعَلَكُمْ خُلَفَاءَ الْأَرْضِ أَإِلَهٌ مَعَ اللَّهِ قَلِيلًا مَا تَذَكَّرُونَ. Nay, who is that responds to the distress when he calls out to him? And who remove the ill that cause the distress and has made you inherit the earth? Could there be any divine power beside Allah? How seldom do you keep this in mind? Sadaqallahu al-Azim. So, with all this being said, we have multiple meetings in the boards, and may Allah protect them and give them reward. We've been meeting almost twice a week, and always on a chat group to try to get the best Ramadan possible for our community. Last Ramadan, we closed the Masjid, but this time we decided, okay, there's people vaccinated, and the CDC said vaccinated people can be together, so we decided to open the door of the Masjid. So our intention to have a safe, fulfilling Ramadan, inshallah, to all the members of our community. The entrance, we're going to have one-way traffic in the Masjid. So we're going to have one door of entry, so the main door entry, and one door of exit. There's no entry and exit from the same door. It's a one-way traffic. Everybody should be properly masked, no exception. Vaccinated, not vaccinated, you have to wear the mask. Everybody will be with the personal prayer rug. Please bring your own personal rug. No exception. You're going to have hand sanitizing prior to entering the prayer area and after you leave. And minimize physical contact with other. Try to maximize eye contact and respect to each other. No, don't come to the Masjid, please, if you have any of the symptoms of COVID that we mentioned. All right? You don't want to be responsible for infecting your fellow brother or sister with this bad disease, especially if they have, high risk of infection. So please stay home if you have any symptoms. If you have mild disease, stay 14 days. If you're required to go to the hospital, we ask to stay 21 days from the start of the illness. And that's when we actually stop the isolation on the patients. You know, in the hospital, after 21 days, if they're infected, we stop the isolation based on CDC guidelines. So we're going to have designated area for non-vaccinated with social distancing, okay? Means 6 feet apart and mask and rugs. The vaccinated people, we're still going to be careful, but we're going to put them together and we're going to do less social distancing so we can accommodate more people. As we mentioned, the CDC said, if you're vaccinated, you should be okay to be with other without mask, but we're going to keep the mask because we have larger gathering. Okay, we're not like two families that being vaccinated. We have more than that. No food in the prayer area because once you eat, you're going to remove the mask. You know, so we don't want to do that. We're going to ask Sheikh Ahmed and Imam to make the Taraweeh shorter. You know, so to get the ajr, inshallah, and not stay long time and increase our exposure. And once the masjid at full capacity, the door going to be closed. First come, first serve. No reservation, no favoritism. Even if I come late, I'll stay out the door. So no exception. And please be nice to our staff. They're working hard, they love you all, and they're doing their job. Don't give them a hard time. And for your safety, we're not going to have any iftars this year, because again, we feel the most risk happens when we eat. When we remove the mask and eat and chat and speak, and those droplets that I mentioned that we're going to share with each other, and if somebody's sick, is going to be a problem. And the fundraising also, we decided to be virtual like last year, because if we don't do it virtual, that's going to involve food also. So that's, mark your calendar for that fundraising, inshallah, April 17th. And after all, the protector is Allah subhanahu wa ta'ala. In Surah Yusuf, verse 46, Allah subhanahu wa ta'ala said, فَاللَّهُ خَيْرٌ حَافِظًا وَهُوَ أَرْحَمُ الرَّاحِمِينَ. Yet Allah's guardianship is better, for He is the most merciful of the merciful. And that's Prophet Yaqub was discussing with his children. And please keep us in your dua, because we need that. We're doing our best. And you don't believe how much our board directors, board of trustees, losing sleep about their decisions to make you have good Ramadan, inshallah, and have a safe Ramadan. That's myself in March of 2020, when we were dressed up to enter the room of a COVID patient. And we were very scared at that time, but we have a very good feeling of helping fellow human. Assalamu alaikum wa rahmatullahi wa barakatuh. If you have any question, I'll be happy to answer. Yes? The 2 shots, okay. So the first shot gives 50% immunity, they noticed. You know, the antibody level will be 50%. The second shot, so when you have the first shot, those cells recognize that protein and mount. When you give the second shot, it's like you have an army and you tell them, you first introduce to them the enemy. See how the enemy look like, this is how the enemy look like. And then when the enemy comes, you know, they will attack more. So the second shot gives booster immunity. So it mounted the immunity into 94%. So if you take only the first shot, you get 50% immunity. Take the second shot, goes to 94%. That's why you're not immune until you do 2 weeks after the second shot. So to go into the vaccinated area in the masjid, you have to be 2 weeks after your second injection. Or if you take the Johnson & Johnson, you have to be 2 weeks after that single shot. Yeah. Yes. So if somebody have an infection with COVID, usually the immunity lasts 90 days, we believe, okay? because we notice people can get reinfected after 90 days. We had few cases of that. So the recommendation right now is that after 90 days of infection, you can get the vaccination, the 2 shots, so you can get better immunity and the protection. Now, how long the vaccination protect, we don't know. We think it's 6 months at least. Okay, if you take vaccine, you're protected for 6 months at least, unless the virus keeps changing itself, and then we have to get a new booster. Yeah. Any other questions? Yes.
How will we verify the people that come in for vaccination?
All right, so we're working on that. So we're gonna have probably a link on. We're gonna send you a code on your phone. We're gonna verify you're vaccinated. You're gonna share with us your vaccination record, and we're gonna send you a code for the whole month, and you use it when you enter the door. Okay, inshallah. Yes.
Since it's emerging, it's becoming more popular. What's the data on the efficacy of the vaccine against the mutated or variant?
So we think the UK variant and yes, repeat the question. Okay, so the question states that the new variant that we have is, how do we know if the vaccination is protecting us from the new variant or not? We know that it protects us against the UK variant. We know it's protect against the South African variant, but less, I think like 60%. But this one, the new one, we don't know. The Brazilian one, we have one case in Bay City, that's the P1, because as I told you, it has a mutation that called escape mutation that evade the virus from the antibodies. So that's why in Brazil, as you know, they did not vaccinate anybody, and they have the massive pandemic there, and they thought they have herd immunity, but now they have a lot of cases now. They're number 3 or 4 in the world because of that new variant. So limiting travel is very important, I think. Just from those areas. Any other questions? Okay. May Allah protect us all, inshallah. Jazakumullahu khairan. Sorry for the long lecture, and I apologize if I scared you, but I have to share with you what I know. Jazakumullahu khairan. Assalamu alaikum.